Gynecomastia is a condition in which excess glandular or fatty tissue creates a fuller appearance of the male chest and often does not improve with training or weight loss alone. In this video, we explain gynecomastia surgery prices, the main techniques used, the factors that influence the final cost, and how costs compare between the UK, Turkey, and Albania. In the UK, the cost of gynecomastia surgery ranges between €4,500 and €9,500, depending on location and surgical complexity. In Northern England, prices are often €4,500 to €5,500. In Central England, they commonly range from €5,000 to €6,500, and in southern areas, especially London, costs can exceed €9,500. The final cost also depends on the complexity of the procedure, the surgical technique used, the surgeon's experience, and the standards of the clinic. Gynecomastia is not always the same condition, and the technique depends on the tissue involved. If the enlargement is mainly fatty tissue, often called pseudogynecomastia, liposuction alone may be sufficient. If firm glandular tissue is present, glandular excision is required to remove dense tissue and create a natural masculine contour. In many cases, the best result comes from a combined approach, using gland removal plus liposuction to refine the chest shape. Liposuction for gynecomastia is a minimally invasive procedure that removes excess fat through small incisions using a thin cannula. The procedure usually takes about 1 to 1.5 hours and can be performed under local anesthesia with sedation or general anesthesia. In the UK, liposuction-only procedures typically range from about €4,000 to €7,500, depending on complexity and the clinic. When glandular tissue is present, glandular excision, also called subcutaneous mastectomy, is required. This procedure removes the firm gland tissue through a small incision placed along the edge of the nipple areola complex while preserving the nipple. It typically takes 1 to 2 hours, usually under general anesthesia, and commonly ranges from €5,200 to €9,500. In more complex cases, surgeons combine glandular excision with liposuction to remove both glandular and fatty tissue. This combined approach provides the most balanced chest contour. It usually takes about 1.5 to 3 hours under general anesthesia and commonly ranges from €5,800 to €10,500 in the UK. When evaluating the cost of gynecomastia surgery, it is important to understand what is included in the quoted price. A comprehensive package usually covers the initial consultation, the surgical procedure itself, anesthesia services, operating room costs, immediate post-operative care, and follow-up appointments to monitor healing. Extra charges can increase the final cost, especially if they are not included up front. These may include pre-operative laboratory tests such as blood work or ECG, post-operative medications, revision surgery, or extra follow-up visits beyond the standard package. Patients who travel abroad for surgery should also consider travel and accommodation costs when calculating the overall expense. Several factors affect the total cost of gynecomastia surgery. These include the severity of the condition, the surgical technique used, the surgeon's level of experience, the type of anesthesia, and the standards of the medical facility. Geographical location also plays an important role, with major cities typically having higher operating costs. In the UK, gynecomastia surgery is rarely covered by the NHS because it is usually considered a cosmetic procedure. Coverage is typically approved only in severe cases that cause significant physical discomfort or documented psychological distress. For most patients, surgery is performed privately. Turkey has become a well-known destination for medical tourism, with gynecomastia surgery typically ranging from about €2,000 to €3,500. Many clinics offer all-inclusive packages that combine the surgical procedure with accommodation and local transfers. However, international flights and some medical tests are often not included in the base price. In Albania, gynecomastia surgery is priced competitively, often through all-inclusive packages that cover surgery, anesthesia, accommodation, and transfers. Typical starting prices are around €1,700 for liposuction, €2,200 for gland removal, and €2,600 for the combined technique. Private clinics commonly follow European safety standards and often collaborate with Italian surgeons. Language assistance in English or Italian is usually available, helping reduce communication barriers. As a result, Albania is often considered a practical choice for patients seeking treatment abroad with transparent pricing. Gynecomastia surgery pricing should always be evaluated alongside technique, inclusions, and structured aftercare. The safest option is the one that matches your anatomy and provides transparent, complete planning. soon. Visit our website to request a free personalized consultation with our team and receive a clear treatment plan tailored to your case.